Thank you, Bev. And before I call upon the next presenter, I'll just give you a brief biography on Bill Yoachim. Bill Yoachim is the executive director for the Ku'Malalam Child and Family Services, where he oversees the delivery of child welfare services and community programming to 9 First Nations communities on Vancouver Island. He has extensive governance experience as a counselor with the Snuimuch on Vancouver Island. He has extensive governance experience as a counselor. Oh, I read that already. 6 years of experience on the board of governance at Vancouver Island University, and an extensive background building strong connections with key stakeholders and community members in the Vancouver Island region. Bill Yoachim has received a Bachelor of Arts from Vancouver Island University and his Bachelor of Social Work from the University of Victoria. So at this time, I'd like to call upon Bill Yoachim.
Thank you for the kind introduction. Respected guests, ladies and gentlemen, Sal Kwan, dignitaries. I'd like to first of all begin by my few comments by thanking Uncle Shane for opening the day, blessing the day. Hi, Chika, Uncle. Thank you very much. I'd like to thank my co-Salish Relations for hosting a beautiful event in their territories. I'd also like to thank the Health Council, Doug Kelly, and the crew for hosting this event. I'm very honored and humbled to stand before you in such a profound room. We have elected leaders, we have council members, we have executive directors of agencies, health directors, etc. So it's very honored to stand before you, and many, many profound respected chiefs as well in this room. First of all, I'd like to begin by just stating, I'm going to just discuss a few points and also about my experiences in this line of work, and a very controversial work, and where I believe my experiences where one may help guide and steer to the betterment of this situation. Because people, we all know we are in a crisis. We are in a crisis. You see it as leaders, you see it as health directors, and I see it as agency director, as my colleague agency directors in the room see it as well, if there are any in the room. First of all, I'd like to begin though on the proposal that that's being developed. I can't share a view on this on behalf of the directors, the 23 agencies, as this is embargoed and it hasn't been shared document at this point. So I'm not able to speak on behalf of the directors' agencies. I'm just speaking on behalf of myself and my experiences as well. Also, I want to relay with the delegate agency world, the decisions such as those that are very contemplated for wholesale change regarding child welfare have to be driven by community. We are not in a position to decide, to make decisions on behalf of communities and leadership. This decision, when we get to the wellness, is it 27 now? The wellness 2027 is going to be community driven from the leadership of everyone in this room. My role of myself as a director and the fellow agencies are going to be following the director of leadership from each and everyone in this room. But I want to totally stress the fact, change is needed. Change is needed. The challenge is the current model that we are in. We're working today in a modern people that is broken and is not working. I don't have to echo all the stats and data you've heard this morning. Fact-based and horrific. So I want to echo that. From the feds, we are underfunded and are essentially not in a true partnership. The feds underfund not just our programs. We all know in the Indian world, we're always underfunded in every area we work in. And this area is drastically underfunded, so myself and many people are anticipating the case Cindy Blackstock has brought forward that will be ruling should be coming out next month or so in regards to inequity of funds on our peoples and our children. So the feds underfund us. B, the province does not respect the autonomy, strengths, and opportunities that our agencies represent. We are also in a broken relationship with the province. Yes, we share tables at conferences and meetings, etc. But again, the province does not respect the autonomy, strengths, and opportunities that we agencies represent, which in theory represents our peoples that put us here to work on their behalf. An example I'm going to touch on briefly is the indigenous lens on practice. There's not much indigenous practice happening around each corner of this province. That is up to us. In the model today, we have to make sure indigenization is incorporated in all our practices and our agencies. Practice should be much better, but we lack proper supports. We as agencies lack the proper supports, and as of recently, actually, we've struggled. It's been sort of, people must be scared to say an agency. To me, the delegate agency, DAA term, it's just a term. I don't like the motto, I don't like the system, but it is what it is. I park it and work on the behalf of our children, what my board members and my chiefs and my nations set myself out to be. So that's a very infant beginning of a model and a mindset I hope we get to. But we are not supported. We are not supported by the governments, and in some cases politically we struggle. The Crown does not respect the self-determination of First Nations, and the agency should be seen as a stepping stone. The Crown does not recognize the respect and the self-determination of us. So the agencies, we're just a stepping stone for children and family and how we should be cared for. How we care for our children isn't up to Bill Yoachim, Kwame Lalem, or the other 22 agencies in BC. It's up to each and every one of how you steer that ship. Yes, there's regulations, but I think everyone in this room would concur that child neglect, child abuse is unacceptable. It's been unacceptable long before contact. And we cared for our children long before contact with success. So it has to be community driven. I'd like to stress the fact, I'd like to thank and appreciate the Health Council and under the leadership of Grand Chief Doug Kelly for bringing this forward and also this conversation. There's been some rumors, some concerns. What's Doug Kelly, Bill Yoachim up to in this child welfare thing? I'm not speaking of Doug Kelly, but what I'm just trying to do is recognize and hear the opportunity where we can bring the much needed practice into each corner of this province, ensure the agencies are supported. Under the present day model, under ANSI right now, they do not want agencies, they do not want smaller agencies, everything's formula driven, and we will not survive if we do not work together and make change, people. The fact of the matter is it comes down to Taylor, the money, and we need the money to exist. From my own experiences as a council member in my community at Snamo for 12 years, and also as a frontline social worker to my role as currently executive director, there are very unique challenges in this line of work. So literally, it is life and death at times. So what's needed is we got to stand together, work on this proposal. This child welfare isn't all wellness. It'll be, in my view, a lens of this. And we get a team of people working on the child welfare component of this, DAs, the leadership, membership of representatives from nations. I'm well aware that I think there's about 80 nations that aren't represented by DA. Absolutely incorporate everybody. This is not a DA venture. This is a venture to make our children where they should be and bring those numbers down. So we need DA's leadership, the nations that aren't represented by DAs, the Health Council, RCY, to work together and create a model that will work to reduce these gaps. People, we have to repair this broken situation. Remaining the status quo is definitely unacceptable and is not an option. We have to stand together as one for the betterment of children and youth. I view, when we get down to the work, roll up our sleeves, the wellness is such a good fit for this. Our struggles, also part of this, in this conversation, we have to have FINESC or whatever education entity the nations, our peoples are working under their models. The wellness of the families in my situations, I'll speak on our files and our struggles in our 9 nations, are a lot of it's mental health. MCFD does not fund or inadequately fund mental health in our backyards. ANSI doesn't even look at it. Under Directive 20-1, I won't get into a formula thing here and belabor it, but it's basically underfunded and there's not much options. We're one of the larger agencies in BC, represent 9 First Nations. Well over that, there's still a child count, and we still don't even get $1 million a year to run the shop. So that's how underfunded the systems are. So back to the wellness piece. we need to have finesse involved. Our graduation rates as Indigenous peoples are dismal. They're improving, absolutely. I want to be crystal clear. We're well aware, and I applaud all the hard work you're doing in that, and we're all doing that. But still dismal. We can improve. But unfortunately, when you get to after our Indigenous rates, the Indigenous children and care rates are drastically lower. That's a crisis. So we have to work together on education, which falls, I believe, falls under the wellness quite well. Mental health is a concern of bringing lots of, unfortunately, situations that we would want with our families. Thirdly, DNA is a struggle at times, and unfortunately, colonization, residential schools, Indian hospitals, all the marginalization leads to substance abuse and DNA at times. So DNA has to be involved. So this whole Wellness 2027 is going to be grand. It is going to be large, and I applaud the crew here, the initiative vision to put this forward. And when we get to the child welfare component, I look forward to being a support where I can with the 23 other directors and how that looks. But we'll incorporate all, and we'll tackle this crisis together, ladies and gentlemen, and respected guests. So I just want to share a few words from the DA perspective, from my DA perspective, but also talk about how I hope in this BC we've been sort of, this file is being rightfully so politicized somewhat. And absolutely, who wouldn't get political over their children? Who would not get political over their children? Absolutely. So I don't look forward to those conversations. I'll leave those up to the politicians' room. It's nice not being on council. Well, I'm on city council, but it's a different arena. And look forward to working with, as a technician, and where we can bring the work together of models and working together with all the wisdom in the room. And it isn't a DEA model. It isn't a non-DA model. It's just a model where we've got to come together, incorporate, work together for the betterment of children and youth. So I just want to share those few words. I thank you for your time, and again, it's an honor to be standing before you, and I look forward to working with each and every one of you in the future, along with my colleague directors that are in the room as well. Hi, Sepka. Thank you very much. Hi, Scott.